In this video, we'll look at treatment for traumatic brain injury, TBI. First, we'll look at treatment for a concussion, also known as mild TBI. The good news about mild TBI is that it's treatable. In fact, most symptoms will improve on their own over time. But the brain is a very complex system, and injuries to it can be complicated and difficult to classify. And every concussion is different and needs to be treated accordingly. Your healthcare provider will first need to know exactly what happened to possibly cause the concussion. They may then do some assessments and diagnostic tests like CT scans or other imaging tests. A treatment plan often starts with an assessment of which symptoms are causing you the most trouble. Those can range from simple aggravations getting in the way of living your daily life, like forgetting where you put your car keys, to more serious problems like depression, substance abuse, impulsivity, or risky behavior. Then, depending on your symptoms, treatment may include medical treatment, individual or group therapy, medications to help control symptoms, lifestyle changes like drinking less or avoiding as much stress as possible, or you may need to see specialists such as occupational or speech therapists. There's no one-size-fits-all when it comes to treating mild TBI. Each concussion is unique, as is each plan of treatment. Yet each plan needs a healthy dose of common sense, too. Factors like eating well, getting enough rest, and exercising as permitted by your doctor can go a long way toward treating a mild TBI. Now let's look at treatment for moderate to severe TBI. Because TBI affects all types of functioning, cognitive, behavioral, and physical, a combination of specialties is usually required for treatment and recovery. A treatment plan to diagnose, stabilize, and intervene can include doctors and nurses from trauma surgery, neurosurgery, and other specialties. Speech, physical, and occupational therapists may also be included. Social supports, case management, and psychological treatment are often necessary as well. Whether these services are administered on an outpatient basis or in a rehabilitation facility depends on the severity of the injury and other factors. Through rehabilitation, medical intervention, and time, most people with moderate to severe TBI will show improvement. In fact, more than 90% of people with moderate TBI are able to eventually live independently. Plenty of service members with moderate TBIs return to duty or to school or work with minimal interruption or difficulty. Those with severe TBI are not as fortunate. In some cases, the ability to perform basic tasks returns. In other cases, those injured service members remain disabled and may never be able to return home, instead ending up in supportive living communities or skilled nursing facilities. But regardless of the severity, folks with TBI need help and love and patience. And the list of care providers almost invariably includes family members, which can bring a whole new set of challenges because TBI often causes changes in personality, which can be confusing. Personality changes may be slight or profound. What were once simple tasks may become very difficult or impossible. People with moderate or severe TBIs may have long-lasting symptoms that interfere with their daily lives and of those around them. The key to recovery is patience. Rehab works, but it takes time. And working with professionals who specialize in TBI works, but that too takes time. Recovery is a mind-body-spirit proposition, so set goals and work toward them. Those who do tend to have better recoveries. Eat well, get enough rest, exercise as your medical provider allows. And this is key to your treatment. Regardless of severity, avoid another TBI. Once you've had one TBI, you're 3 times more likely to get a second one. And once you've had 2 TBIs, you're 8 times more likely to have a third. With each injury, recovery will be slower and the symptoms may be more severe. Adjust your headrest. Wear your seatbelt. Wear a helmet. Use protective gear. Avoid dangerous activities that require quick reaction time. Now, these may sound like obvious steps to take, but unfortunately, many people put themselves at greater risk by ignoring them. The fact is, you are your own best defense against another TBI.